Okay, here we are again. In today's lesson, we are going to dive into a lot of the language of anatomy. It is really, really important that you spend a lot of time practicing this language and using the terms in your daily life and using them out loud and learning how to pronounce them because mastering this language is just going to make the rest of this course that much more manageable. So let's get into it. In today, we are going to talk about anatomical position. We'll then talk about body sections and planes, directional terms, regional terms, the body cavities and membranes, and then we'll finish out with the abdominopelvic regions and quadrants. So let's talk about the anatomical position. Anatomical position is a standardized way in which we refer to the body. So it provides a common reference when we're talking about different parts, where they are, and it gives us all the same frame of reference. So when we're talking anatomical position, it's always referencing the body standing upright. The feet are parallel and on the floor. The head is level and looking forward. The arms are at the side. And then this is the most important detail here is that the palms are facing forward and the thumbs are facing out, right? So notice here, and let me get my pointer. Notice that her palms are facing forward and the thumbs are out to the sides. Okay, so that is proper anatomical position. And that is how we refer to body parts and where they are. We always think about that because it doesn't matter if the body's folded over, laying down, upside down, all the terms that we reference them in terms of anatomical position. So, anatomical position and the body planes. So we always also take the body and we can divide it into three planes that will bisect the body in three dimensions. So the first one we have is the coronal plane, or sometimes called the frontal plane. This plane is going to divide the body into anterior, front, and posterior parts. So you can see here the purple, get my pointer again, the purple plane here, that is the coronal or frontal plane. So it divides the body so you have a front half and you have a back half. The next plane is called the transverse or the cross-sectional plane. This plane divides the body into superior or upper and inferior lower parts. And that can be across the body anywhere that divides it into upper and lower parts. The mid-sagittal plane, sometimes called the median plane, this is going to divide the body into equal left and right halves. Sometimes there's also referred to a plane called the sagittal plane. That divides the body into left and right, but not equally. So imagine just a plane coming straight through part of my body, but it's not directly through the middle. When it's directly through the middle, we call it the mid-sagittal or median plane. So those are the other sagittal planes divide the body into unequal left and right parts. We also have the oblique planes, and they pass through a specimen kind of at an angle, right? So let's talk about anatomical directions. And in my opinion, this is probably the most important aspect of this lesson is really mastering what I call directional terms. And these are terms that tell us where body parts are in relation to other body parts, right? In our daily life, we use directional terms. We say forward, backward, left, right, up, down, east, west. Those are all terms that we use to relate where things are compared to others. And in the body, we use a specific set of terms. So again, we're all speaking the same language. So some common directional terms are the anterior versus posterior. So anterior, also known as ventral, refers to belly side, or the front. Posterior sometimes known as the dorsal or backside. I like to think of like a dorsal fin on a shark or a dolphin. Ventral literally means belly side. For example, we would say that the heart, which is in here, is posterior to the sternum. Okay. Um, or I could say my spine is posterior to my belly button. Um, I could say my nose is anterior to my ears, which are behind it. The next set of terms are superior, towards the head or up or above, versus inferior, which is below or towards the feet. Um, in animals that walk around on four legs, sometimes we talk about caudal, which is towards the tail, and cranial, which is towards the head, and rostral, which is towards the nose. So if you're looking to become a veterinarian, you might use those terms a little more so than superior or inferior. Medial means towards the midline. So think of that mid-sagittal plane. Medial is towards that midline versus lateral is out to the sides, away from that midline. Um, Ipsilateral means same side versus contralateral means opposite side. Deep means internal. I could say my bones are deep to my skin. Superficial is external. My skin is superficial to my bones. Proximal, this is proximal and distal. These are the ones that are probably most confused. Uh, Typically, we use these when we're talking about limbs, arms, and legs. And think about the attachment points. My arms attach to my shoulders, my legs attach at my hips. If I'm talking about body parts on my legs, proximal means closer to that attachment point, closer to my hips. Distal, like distance, means away from the hips or farther away. So again, here's some pictures. So anterior is pointing forward, posterior is pointing back, superior, you have arrows pointing up, inferior is below towards the feet. Medial, right? There's that mid-sagittal plane, the median of the body. Medial is toward that midline plane. Lateral is away from it. The proximal, right? Again, so proximal and distal, we're talking about limbs. So here's limb, an arm and a leg. The arm, proximal is towards the shoulder. Distal is away from the shoulder. Or when we're talking about the legs, proximal is towards the hips. Distal is away from the hips. The next set of terms are called regional terms. And like the name suggests, these are terms that talk about different areas or regions of the body. You might think of a town or a city and that has different neighborhoods, different areas. We talk about downtown, or in Stockton, we might talk about South Side, or we might talk about Lincoln Center, or we might talk about the area or the region that surrounds Delta College. The regional terms are divided into two main regions, the axial and the appendicular. And when we get big words like this, it's really, really important that you take the time to try and pronounce them and say them out loud. I like to say that if I can pronounce a word, I own that word. But as long as I am scared to pronounce it, that word has some power on me, and it makes it much more difficult to learn that. So whenever you can, say these words out loud, talk about them, refer to your body, talk to your friend, neighbor, spouse, children, whatever it might be, to practice these terms. So the axial region refers to the head, neck, and trunk area. It's the vertical axis of the body, vertical up and down. The appendicular region refers to all the limbs, things that are hanging off of that trunk. And there's several more specific regional terms that describe these major subdivisions. So these terms, I hate to do this to you, you got to know them. You got to go in there. I highly recommend taking your body organizers like this, getting some colored pencils, dividing up the regions and writing them down. And then I also suggest getting like some sticky notes or even a marker that's washable and write these terms on your own body or on, like I said, a friend, a trusted neighbor, a child, whatever it might be. Make sure you got their consent first. And then just go through and list these regions. When you master these regions, then everything else we do this term is going to fall into place. We talk about body cavities. The word cavity means like a hole, right? Think of a cave inside of a mountain is a cavity, right? A cavity in your tooth is like a little hole in your tooth. So we talk about the body cavities, and these are open areas within the body. We talk about the thoracic cavity in your chest, the abdominal pelvic cavity is below that. The cutoff here is this big muscle called the diaphragm. This is a muscle that helps you to breathe. So that diaphragm is a good reference point. You can kind of feel where that is. It's just if you feel like your lower ribs, and if you take a big breath in and you breathe it out, you can feel that diaphragm working. That's separating that upper thoracic cavity from that lower abdominopelvic cavity. In the posterior portion of the body, remember posterior means towards the back, you have the cranial cavity formed by the skull and its bones, the vertebral canal formed by the vertebral column. That's where your spinal cord runs through all those vertebrae. In the ventral cavity, remember ventral means belly side or front side. It contains two smaller cavities separated by the diaphragm. We talked about those as the thoracic cavity up top and the abdominopelvic cavity on the bottom. Abdominal cavity can also be divided as the abdominal cavity, which is superior to the pelvic brim, right? That's right where kind of your pant line would fit. And then the pelvic cavity would be below that or inferior to that. The ventral cavities are lined by something called serous membranes. And these are divided into two continuous parts or layers. The parietal layer lines the internal surface of the body wall, and the visceral layer covers the external surface of the organs, or what we call the viscera. Between those layers is what we know as the serous cavity, and it's filled with, crazy enough, serous fluid. This reduces friction between moving organs in your body. Think of all the different ways that you can move and contort your body. This prevents those organs from rubbing up against each other. So one way to think about this serous membrane is think of a balloon, not pumped up super, super tight, but just kind of a balloon, and take your fist, and your fist represents an organ, and you push that into the balloon. And as you push that into the balloon, right, the balloon sort of inverts in itself, and there's an inner lining that's directly on the organ, or the fist in this case. And then you have this outer layer, which is the outside, which is outside of the balloon. The serous cavity is all of this space in between, right? And that's filled with that serous fluid. So that's how we kind of can think of the serous membranes and what they're doing. So in the median space, in the thoracic cavity, we have the mediastinum. This contains the heart, the thymus, the esophagus, the tube that goes to your stomach, the trachea, your windpipe, and a lot of major blood vessels. We also have the pericardium. This is serous membranes that surround the heart. We have some terms in there: the parietal pericardium, the pericardial cavity, and the visceral pericardium. And then we have the pleura, and this is the serous membranes that surround the lungs, right? So cardio refers to heart, pleura refers to lungs. Now the parietal pleura, the pleural cavity, and the visceral pleura. Notice that some of these terms are starting to repeat, and we're just combining these regional terms, our directional terms, and some of our membranes and cavities. So again, here's that membrane, that serous membranes in the thoracic cavity, right? We have the parietal pericardium that is going around the heart. The visceral pericardium is in the middle, and the parietal cavity, which is filled with that fluid. So the parietal pericardium, that's the outside, the outer layer. The visceral is the inner layer. Visceral typically means deep to or internal. Again, with the pleural membranes, okay, we have the parietal pleura, which is on the outside, the outer layer. The visceral pleura is on the inner layer. And then that inner portion of the balloon, that's that pleural cavity surrounded by that serous fluid. And here's a good picture of that diaphragm muscle that separates the thoracic cavity from the abdominal pelvic cavity. The peritoneum are the serous membranes that may be around many of the abdominal organs. Again, parietal lines the internal walls of the abdominal pelvic cavity. That would be outer to the organs. The peritoneal cavity is that potential space with the serous fluid. The visceral peritoneum, that's that inner layer that's going to be right up along those digestive organs. Okay, again, we have all these organs in the abdominal pelvic cavity. You have that outer parietal peritoneum. You have the inner visceral peritoneum right up along those organs. And then inside between there, you have that serous membrane, the serous space right inside there. All right, we've got an alarm going off. And then our last major thing is to talk about the abdominal pelvic regions and quadrants. So these are imaginary divisions that help us accurately describe the locations in the abdominal pelvic cavity. We have 9 regions. You can see them here with the epigastric region, the right and left hypochondriac region. One thing to recognize is we're looking at this in terms of anatomical position. So when we are looking down on the body, think of that body's looking back at me. So this is right, that's on my right side, right? So think of the abdominal cavity with your rights and your lefts. It's one thing to really be conscious of when you're studying these. And then the quadrants, right? Just 4 quadrants, the right upper quadrant, left upper quadrant, left lower, right lower. And those are how the abdominal pelvic cavity is divided. Lastly, to sum things up, we talked about anatomical position, the body sections and planes, directional terms, regional terms, the body cavities and their membranes, and the abdominal pelvic regions and quadrants. I hope that was helpful. Hope it made some sense, and we'll see you soon.